Hey, can I come in?
Sure.
Hi, how are you doing today?
I'm doing pretty good. How are you?
Doing good. I'm washing my hands. What is your first and last name?
Jamarca Ison.
Jamarca Ison. Hi, Jamarca Ison. My name is Dedrick Buffin. I'll be your nurse today, okay?
Hi, Mr. Buffin.
Hi, I'm coming in to do an assessment. That's fine?
Yes, sir.
All right, just start by putting stuff up for me, please.
Sure.
All right, just sit down for me. Just sit up straight for me, but great posture. Okay, good. Now, let me see your arm. Just checking your skin tone. I'll check your mobility and your posture so everything is good, okay? That's what we're going to do. I'm going to start with your head, okay, Jamarca? Your head is intact, the rest of your body. It is symmetrical. Skin tone is great. It is even with the rest of your body. Now I'm going to go on top of your head, okay? All right, I'm checking your skull. Everything looks fine. Your hair is intact with the rest of your head. Now I'm going to do a light palpation of your head, okay? Let me know if you feel any type of pain. You feel any pain?
No, sir.
All right, I don't feel no swelling, no edema, so everything feels fine. Okay, next one I'm gonna check your frontal sinuses, okay? Let me know if you feel any pain, okay? Feel any pain?
No, sir.
Okay, great. Next one I want you to do, Jamarca, I want you to give me a big smile. Very big smile. Great job. I want you to brighten your eyes for me. Great. Now I want you to lick your tongue out. I want you to go left to right. Great job. I'm checking your cranial nerves 7 and 11. Everything seems to be functioning fine there. That's what we're going to do. We're going to move down to your neck, okay? Just going to start checking your cervical vein, your anterior. I'm going to go down next to your posterior. You feeling any pain?
No, sir.
All right, great job, Jamarca. Now what I'm going to do, just going to take and listen to, well, we're going to palpate your carotid artery, okay? So if I get a pulse there, I get a pulse, okay? To this side. All right, next I'm gonna just listen to your carotid artery, okay? Sorry. Everything sounds fine. Now, Jamarca, what I want you to do, I want you to do a range of motion with your neck. That means I want you to lift your neck down. I want you to lift it back up. I want you to go to the left. I want you to go to the right for me. Do you feel any stiffness, any pain?
No, sir.
All right, great job. Now we're going to move on to your nose, okay? I'm just going to do a light palpation on it. Let me know if you feel any pain. Does that hurt or anything?
No.
Great job. Now, I want you to hold down one of your nostrils. I want you to breathe in, breathe out. Great job. Breathe in, breathe out. Did you have any difficult breathing?
No, sir.
All right, I'm gonna just take a look inside your nose, Miss Jamarca. Make sure everything inside is fine. It does look fine. What I'm gonna do, Miss Jamarca, I just want you to smell. Let me know if you can smell what I'm about to spray, okay?
Okay.
Can you smell it?
Smells like baby powder.
Thank you. All right, Mr. Mark, and that's what we're going to do. We're going to listen to your ears, okay? You just do a light palpation, try to feel any tenderness. Do you feel any pain?
No, sir.
All right, and then feel any swelling. That's what we're going to do. I'm just take a look inside your ear. I'm just checking your auditory canal. All right, I'm going to check this side. All right, everything looks fine. That's what I'm going to do. I'm going to whistle something in your ear. I want you to repeat it out loud to me, okay?
Pink pants.
Okay.
Blue pants.
All right, great job, Mr. Marker. Next one I'm going to do, Mr. Marker, we're going to check your eyes, okay? All right, everything looks symmetrical. Just check your conjunctiva. It's pink and it's moist. Your sclera is white and moist, so that's a great sign. Next one, what you do, Mr. Mark, I'm going to check the reflection in your eyes, okay? I want you to put your hand in the middle of your forehead. I'm going to look at the reflection of your eye with this, okay?
Okay.
And not feel any dizziness or any pain, okay? All right, I see a reflection of light in this eye. I see a reflection of light in this eye, so let you know you have a combination with Perla. Do you feel okay?
Yes, sir.
All right, next we're going to do this 6 cardinal gaze of cardinal with you, okay? I want you to follow this pin wherever it goes with your eyes, okay?
Yes, sir.
Ready? feel okay? All right, now I'm just checking your cranial nerve 3, 4, and 6. Everything seems to be functioning fine. There it is. All right, next what we're gonna do, we're gonna take an inspection of your mouth, okay? All right, your lips look pink, it looks moist, looking symmetrical with your face. Next one, look inside of your mouth. Look inside your mouth. Thank you. Lift your tongue up on me. All right, I'm checking your teeth, your gum. I don't see no signs of gingivitis. Your teeth intact with your gum, so that's great. I'm just gonna feel around for your heart rate and your soft bed, okay?
Yes, sir.
All right. All right, your tongue feels fine. It's moist. It's pink. All right. Feeling your hard plate feels fine. Soft plate feels fine. That's what I'm gonna do. Take a look inside the back of your mouth. I'm gonna check your uvula and I'm checking your tonsils, the presence of your tonsils. Okay. So on the count of 3, you should say "ah" for me. Say "ah." All right. Great job. Your uvula is midline. Your tonsils is intact as well. I'm gonna get at a grade 1. It's visible and it's enlarged. Okay. Next one, Mr. Mark. I want you to lay down for me.
Yes, sir.
Shut up just midway from me. I'm just checking your checking your abdominal area, okay? Your contour is round. Go down here, I'm gonna check the symmetry of your abdominal area. All right, your respiration is evenly. With your abdominal area, the skin tone is even. I don't see no type of marks, no type of moles. Everything looks fine. Next, we're going to just take a listen to your bowel sounds, your abdominal area, okay? Now, do notice the presence of your umbilicus. I don't see no drainage, so that's a good thing as well, okay? You start up here with your right quadrant. Go down to your right lower quadrant. Get to your left lower quadrant. And your left upper quadrant. All right. Next one, I'm doing a little light palpation of your abdominal area, okay?
Yes,
And if you feel any type of pain. Everything okay?
Yes, sir.
All right, next I'm gonna do a deep palpation of your abdominal area, okay? I'm just checking for any masses or any tenderness, okay?
Yes, sir.
And if you feel any pain. Feel okay? All right, great job, Mr. Marcus. Next one, you to sit up for me. I'm gonna take a listen and look, inspection of your lungs, okay? Turn around a second. You lift your shirt up just a little midway from you. Just take a look at it. Looking at your respiration. Everything looks even, looks fine. You're not showing any signs of difficult breathing. I don't see no signs, any blue signs on your skin. You take a look at your mucous membrane. It's pink as well. Look, take a look at your nails. All right, you're getting oxygen there. That's a good sign. Next one I'm gonna take a listen to your lungs, okay? You start with your anterior. We're gonna go down. We're gonna go to the back to your posterior, okay? Keep falling. Sorry. All right. I want you to breathe in with your nose and out with your mouth. Okay, ready? In with your nose, out with your mouth. 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 Out your nose, out your mouth. In with your nose, out your mouth. Out your nose. Out your mouth. This your lung. Let me. Oh, in with your nose. Out your mouth. In with your nose. Out your mouth. This side. In with your nose. Out your mouth. Out your nose. Great job. You stand up for me. Take a listen to your posterior, okay? Same thing. In with your nose. Out your mouth. Ready? In with your nose. Out your mouth. In with your nose. Out your mouth. In with your nose. Out your mouth. Good job. In with your nose. Great. In with your nose. Out your mouth. 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 One more time. In with your nose. Out your mouth. All right, great job, Jamar. And that's what we're gonna do. You can turn back around for a minute. We're gonna take a listen to your heart, okay? You just lift your shirt up just a little bit up for me, so I can just inspect your chest wall. All right, your anterior chest wall, everything looks fine. You see like you're getting breathing, your respiration is great. Don't see no signs of difficult breathing there as well. All right, now I'm just going to take a listen, okay? I'm going to start at the second intercostal space. That's the aorta. You just breathe normal for me, okay? All right, come over here to your pulmonic. All right, go down here. I'm sorry, just thank you. Here with your herbs. All right, here to your mitral. You try cups, I'm sorry. And over here, your mitral. All right, great job. I heard the sound of S1, S2, didn't hear no sounds of S3 or S4 or no type of murmurs. That is a great indication, great findings. This one just palpate your apical space right here at the fifth intercostal space, I'm sorry. All right, it has pulsation, everything feels fine. Do you have any questions for me, Mr. Martha?
No, sir.
All right, the doctor will be instructed to finish your examination. Thank you for letting me assess you, okay?
Thank you, Mr. Gabriel.
You're welcome.